My name is Guy Jones and I run Reagent Tests UK. We're a tiny company operating in the UK selling chemical drug identification kits for people who use drugs. Typically in a home setting, and certainly in the past, there would have been two methods that people use to identify their drugs and make sure that they're safe. The first is trusting the person who sells them, and the second is the visual appearance of the drugs. But of course, in a black market, trust is something that is difficult to find and really something that's not ideal to be relied upon. And also the visual appearance of a drug is not something that you can rely on because there are many drugs that are white powders or white crystals. So because the market is unregulated, there's very much a chance that by relying on those methods, you could run into harm. Reagent tests work by reacting with a substance that's being tested to generate a colour change, and the colour change very roughly corresponds to the chemical structure of the drug. So we have a reaction chart that shows people the drug that they might be expecting and how they would expect that to react. And so what we have here is a more reliable way to identify and alert ourselves to cases where the drug has been sold as something that it is not. So in the case of MDMA, perhaps PMA has been sold in its place and there is the potential for quite a lot of harm there. So if we can just identify a very small number of those cases, then straight away we're eliminating a portion of harm from that people who use drugs are exposed to, and reducing the hospital admissions that could be related to that, and in some cases perhaps even preventing a fatality. There's another aspect to the harm reducing potential of reagent tests or any drug checking method, which is the empowerment of people who use drugs to understand that they are not playing a game of Russian roulette. They do have a role to play in their own safety and they can start to take control of that. So not only do we have the benefit of encouraging them to test their drugs and identify those samples which may be a deliberate mis-selling attempt, but we also have the chance to engage them by using a kind of credible harm reduction method. We set up that channel, that communication channel with them, and we can then open the conversation and start saying, did you know also that you can reduce harm by doing X, Y, or Z? So we also have a leaflet here which has some information about reagent testing on one side, and then on the other side it has pragmatic tips for staying safe when using MDMA. So things like staying cool, and guidelines for sensible dosing, which again are things that people can, before negative events happen, they can start to take control of their safety and make sure that they are coming to a minimum amount of harm. So there are a lot of different harm reduction tools that are available to us, and none of them are perfect. We aren't trying to eliminate harm, but we are just trying in any way that we can to reduce it. Reagent tests are a very low cost method, and they will struggle in cases where somebody is deliberately mixing a desirable drug and an undesirable drug. But as I say, what we're really trying to do is reduce harm in any way we can. And if we can just prevent that small portion of cases, then we have already prevented some people from coming to harm, and that's the goal. It doesn't need to be a complete elimination of harm.